I think we need to consider the population in care homes, so they're often some of the most vulnerable in society, often elderly, often with comorbidities, so multiple different illnesses. So it's not surprising that those patients get sick and get sick quite frequently. And the challenge really is to recognise the early signs of that so that we can intervene at a stage where we can still do that safely in the community.
We can continue to embed what we know about residents and deterioration. I think I would love to see the News 2 scoring tool out into the community so that they're speaking the same language as all the healthcare professionals, because I think it's very important the care homes are included as healthcare professionals. They're looking after a large amount of people. And sometimes they can feel a bit forgotten. So if we empower them and we teach them and they recognise softer signs of deteriorations in patients, then they are then timely escalation is taking place, which means we have more opportunity to turn around, and that provides more wriggle room overall for all of our community services. It gives us the gift of time.
We've run a series of innovation sprints, so we've worked very closely with care homes to develop resources to allow them to start conversations about things like sex and intimacy within the care home sector and how that could be part of care, and how issues around consent and capacity can be dealt with. And we run an accelerator program which invests in great ideas like jelly drops, which have been designed to avoid people in care homes becoming dehydrated by having these hydrating sweets that they can eat throughout the day.
I think in order to move from a scenario where we have individual pockets of excellence, we now need to systematise some of these early innovations. So we've seen lots of good examples of how telehealth and teletriage have been used in care homes. We now need to make that everyday practice.
Teletriage is a nurse-led project working on the Wirral. We look after 76 care homes and we offer them clinical assessments for residents who they've got concerns for, and we utilise Skype for Business digital tech in order to safely assess the patients and visualise them as part of the assessment.
We want them to be autonomous. We'd like them to be connected with people both in the care home and outside of that. An example being Memo Ride, very good example that's been used in care homes, an example in Bradford, where people that live in care homes are on an exercise bike with a large screen in front of them, and they could be riding down the street where they grew up as children. So it gives them that exercise, it helps them therefore to sleep better, it helps them obviously in terms of their energy levels, but also it's that reminiscent side, they're going back to where they were as children.
One of the initiatives we're hoping to introduce in Lancashire is the introduction of Robopaths, and this is Arnie, and we've had him donated to Lancashire County Council, and we've been able to support 20 Robopaths across Lancashire. You can turn him around like that, you'll be able to see him, and this is generally for service users that are losing capacity or have dementia and they would prefer to have pets in their house, so it's been seen as a very calming influence to helping people manage some of their challenging behaviour.
And then of course we need to make these innovations, the products and the pathways available to everyone so we can all share in some of the great work that's gone on so far.